hope this next segment might be helpful to you moms and dads. New Hampshire keeps seeing pediatric cases of COVID-19, but booster shots could soon be expanded to more teens.
We ask you to send in your questions for Chad pediatrician Dr. Charles Capetta. He joins us live now to answer those questions. Let's get right to them. Good evening, Dr. Capetta.
Good evening. How are you?
Good, thank you. Thank you so much for joining us. Let's start with the FDA's decision to allow Pfizer boosters for children as young as 12. Now, the CDC still needs to sign off on that expansion, but what's your initial reaction to that move?
Well, if I could jump to the moon right now, I would. I am very excited, to be honest. This is a groundbreaker for us in pediatrics. As we heard earlier, the forecasts, the cases are going up and up, but now with the unprotected kids less than 5, we worry more about that, but the booster dose will go a long way to further protect the pediatric group from 12 and above. I think it's great.
And we do want to get to viewer questions now. Caitlin has two. First, if your child had COVID and had been half vaccinated, should you wait 90 days to get their second vaccine?
Well, that I probably would defer to the experts there, but my recommendation is as soon as you can get it, you should be able to get it because we want to keep protecting them. And officially, you're positive for COVID for 90 days, like you asked, Caitlin. So I would check with your pediatric office. For me, right now, I would say that's a great question, number one. But the fact that you're half vaccinated is it just means you just need the booster, which you're getting 85 to 95% protection. So I think you're pretty good right now.
Well, Caitlin also asked, have you seen children experiencing lingering symptoms such as headaches after the initial illness?
I have, yes. And the long COVID syndrome is now increasingly an issue with pediatrics, and which includes fatigue, poor concentration, things like that in particular, and headaches. And so it can linger on, and I think the treatment of the symptoms is important, but also, check with your pediatrician if we're having any concerns about difficulty breathing or symptoms like that.
Cami asked, I'd like to know what pediatricians recommend to parents who live in school districts that do not have a universal masking policy, do not enforce distancing, do not have proper ventilation or filtration, or don't carry out contact tracing when cases are found. What do you tell parents like Cami?
And Cami, great question. Here in Nashua, where I reside, we just passed the mandate here after 3 weeks of discussion because of our increasing numbers. I'm the school doc for the Nashua school system, and have worked hard to try to enforce all those same things you're asking for. But for those that are outside in schools that don't, I think you just have to have an honest communication with your school board. You have to have an honest conversation with the people in charge of looking after your kids, and say that social distancing, mask wearing, hand washing, vaccines are all great. But if we don't have this operational in the schools that the kids reside in 8 hours a day, we're missing the boat here. And we just have a potential petri dish of illness going back and forth and back and forth.
Elisa asks, I was one of the early ones boosted and am immunocompromised. My Moderna booster was September 15th. Do we know if there's any protection left after nearly 4 months?
Well, I would say in most cases, especially with immunocompromised, we worry most about that population, both in kids and adults. So I'm going to answer that from my generalist perspective. Yes, you do have protection. But you would be, if you haven't had your booster, and now we're recommending potentially even a third booster to be fully vaccinated, I would seek that as soon as you can. But there is some immunity available. You still have immunity. It's probably waning a little bit, but I would give you, good protection already since you had it.
Dr. Capetta, we have many more viewer questions to ask you. We're going to take a break and then ask some more after that break. Thank you.